Hello, everyone. Welcome to the Save Vaping, Save Bangladesh webinar. I'm Ishraq Dhali from Voice of Vapers Bangladesh. Our goal, Vapers, is to create and cultivate a community that promotes living and advocates for modern alternative solutions to smoking. Our primary goal is to raise awareness through scientific evidence and correction from reliable sources to promote safer alternatives to smoking tobacco. Now, as we all know, recently the Ministry of Health and Family Welfare of Bangladesh prepared a draft to bring another amendment to the Smoking and Using of Tobacco Products um, Control Act. Among the proposed changes, the ministry has opted to impose a complete prohibition on electronic nicotine delivery systems, including vapes and such other alternatives to conventional smoking. Therefore, we decided to organize this webinar to draw attention to our respected policymakers and urge them to rethink their decision. Considering the significant amount of scientific evidence that suggests vaping and other reduced risk nicotine delivery systems are far safer than traditional cigarettes. Now, countries such as the UK, New Zealand, Canada, and numerous other countries with smoke free goals are actively promoting these products uh, as opposed to conventional cigarettes. By incorporating a tobacco harm reduction framework, we can learn from their success stories and replicate that here in Bangladesh, along with a separate set of risk proportionate regulations, we hope. Without further ado, let me introduce our distinguished panelists today. We have with us, starting with Dr. Dylan Human. He's the president of Health Diplomats and the founder of tobaccoharmreduction.net. Dr. Dylan Human is a physician, author, and longtime advocate for harm reduction and tobacco control. Previously, Dylan served as Secretary General and CEO to the World Medical Association, Secretary General of the International Food and Beverage Alliance, Director of the African Harm Reduction Alliance, and advisor to the WHO Director General and to the UN Secretary General. In tobacco harm reduction, he is a published author, international lecturer, and a healthcare consultant. Dr. Dillon holds qualifications in medicine, child health, and business studies. Next, we have Mr. Shumon Zaman. He is the president of BENSTA, or Bangladesh Electronic Nicotine Delivery System Traders Association. The organization was founded in 2020 and is well known for its support of vaping rights. It is also represented by all of Bangladesh's major vape importers. Mr. Shumon also owns Vapor Cloud, one of Dhaka's most well known vape shops. He's been urging smokers to switch to vaping since 2013, when he successfully quit smoking himself after 27 years, only with the help of vaping products. Also with us, we're very glad to have Mr. Michael Landel. He is the director of World Vaping Alliance, or WVA. Mr. Landel has been dedicatedly supporting the vaping community worldwide and their rights to vape through the World Vaping Alliance, uniting vapers around the world and creating a dialogue to help smokers get access to vaping devices. We also have Dr. Mithun Alamgir. He is the head of Department of Community Medicine at Enam Medical College. He is one of the most well-known advocates of vaping in Bangladesh. Dr. Mithun has been vocal about how smoking is harming millions of people while we have healthier alternatives of vaping devices. He has written articles with scientific evidence in an attempt to persuade readers that vaping is the best smoking cessation tool available for long term smokers who are unable to quit. Lastly, but not the least, we have Mr. John Dunn. He is the Director General of the UK Vaping Industry Association. Mr. Dunn has a lengthy and reputable history in the European vaping world and has held key positions in some of the top sectors in the industry. Additionally, he has provided financial institutes and industry experts with advice on the vaping market, both in the UK and internationally. A very warm welcome to all of you. Without further
Thank you.
ado, I am going to jump into my set of questions. I'm prepared, but just to begin an open discussion, and this is for all of you or whoever wants to take the question. Uh, so now you know what is happening in Bangladesh in terms of the proposed policy. What are your thoughts on the Ministry of Health and Family Welfare of Bangladesh's draft to bring an amendment to this Smoking and Using of Tobacco Products Control Act, proposing to ban vaping?
Ishak, if I may start, as a physician, I'm perturbed and very worried by this development. If you look at the primary mission of a Ministry of Health and Welfare in Bangladesh, and by the way, any country in the world, the primary mission should be to prevent disease and premature death, especially where you have tobacco-related disease, which in most countries form more than 80% of the non-communicable diseases that cause disease and lead to premature death. Now, if you take to Bangladesh, wonderful country, 164 million people, of which 20.9% of the adults smoke cigarettes. And every year, there are 161,000 deaths because of tobacco-related disease. So if you look at the main mission of the ministry, it should be to help prevent these deaths. And the colleagues on the panel and throughout the world, we've seen that e-cigarettes have provided a fire escape to adult smokers around the world. We know that the reason why it's provided this fire escape is with combustible tobacco, it's the smoke and the tar that kills and causes disease in adult smokers. Now, to take away the fire escape is almost equivalent to taking away seat belts in cars. I was just having a discussion with an ophthalmologist in the UK recently who said that his work changed when seat belts were made mandatory. We know from a public health perspective, if people use seat belts, it diminishes the risk of death by 45% and the risk of serious injury by 50%. So Public Health England and other reputable science-based organizations worldwide have the consensus that e-cigarettes are 95% less harmful than cigarettes. And it is really a worrying development to think that a ban would be put in place if there wasn't a thorough and robust evaluation of the science, as has been done in other countries. Thank you for that opening statement.
Right. If anyone else wants to take me on that point about what your thoughts are on this draft amendment.
Maybe just adding from the consumer perspective, what are the effects of such a ban? And the only effect is that people will have access to cigarettes, but not to less harmful alternatives. So that means those who still want to seek out, they are pushed to the black market. And we always know prohibition doesn't work because we can't ban demand. So there will be demand, people will go to the black market, and there will be shady actors who will try to satisfy this demand. So also from public health perspective, it's a negative outcome, but also for consumers, because eventually they will be criminalized. And they will interact with very shady actors where there are no safety controls, no quality controls, no age checks. So it's probably the worst you can do if you want to improve public health, but also satisfy consumer demands. I think the goal should be to give different people the most options as possible to quit smoking. It's kind of ludicrous to keep a product which kills half of its consumers on the market, but try to ban a way less harmful alternative. That doesn't make sense at all from my point of view.
Absolutely, right,
Very
Michael.
nicely put.
I'll go next if I may. I think the US or the UK is a great example of what should be happening. We recently had the latest Action for Smoking and Health numbers come out last week, and we've seen an 8% increase in vaping in the last year here in the UK. We're at 4.2 million vapers now, out of 7 million continuing to smoke. So for us, it's a huge success. Vaping is now the most successful way to quit smoking in the UK. It's proving to be twice as effective as all of the other methods combined, which for me is really setting the standard that other countries should be looking at, rather than trying to take this moralistic prohibitionist approach towards nicotine. We all know that it's the smoking that kills, it's not the nicotine. But for some ungodly reason, people have this fear of nicotine.
I'd like to add to this that I don't agree that this is. We need to understand that this is a Tobacco Control Act, and I do not agree vaping to be considered as a tobacco product in the first place. Just because it has nicotine in it does not make it a tobacco product. We all know that there are many other sources where tobacco is being synthesized. The nicotine is being synthesized as well. So it's like thinking that if a medicine contains caffeine, then it should be considered as a coffee product. But we know that there are some medicines, painkillers, which contains caffeine, but those are not considered as coffee-derived product. And this is what I just wanted to say, that this is not a tobacco product. Vaping is a separate segment altogether.
And it should be treated like such. Thank you. I think we got some great comments. I'm going to turn back to Dr. Dillon. I think you touched upon this in your opening statement, but just so that we better understand from your perspective, is the nicotine in vapes more harmful than cigarettes, as stated by a representative of the National Tobacco Control Cell, NTCC, in Bangladesh? Is it really more harmful than?
Well, this question is not a debating question. It should be a scientific question, and it should include a robust scientific process to make sure whether nicotine in its various delivery systems or forms, whether there's any difference at all. I wrote a book 10 years ago called Why is Nicotine?, arguing that nicotine as a social drug can be compared very much, as a previous speaker said, to caffeine. If we were going to take caffeine or caffeine leaves and set that alight, it would also cause danger. So the whole issue is about combustion versus non-combustion. And to me, as a physician and as a scientist, there's been a disinformation campaign to claim that nicotine in e-cigarettes are somehow more dangerous than in cigarettes. There is absolutely no evidence for this. And what I would like to cite as one of the primary references is the United States FDA, who last year approved several e-cigarettes after a very lengthy process, 5 years of testing, hundreds of millions of dollars of research money, in which there was a process where they firstly looked at the chemicals in e-cigarettes, and they made sure that the overall harmful or potentially harmful ingredients were tested. Secondly, they looked at the risk-benefit for the population as a whole, which would include the non-users of those products and especially the youth. And they also have in place a system where there's post-marketing surveillance, where they would look at the delivery of nicotine through e-cigarettes over time to make sure that there isn't any unknown risk to the consumers. So in short, the United States, in the UK, John Dunn has already said there's been a thorough evaluation by the UK government, not the industry or any other stakeholder with potential conflict of interest, but by the government, where the public health report has unequivocally stated that e-cigarettes and the nicotine in e-cigarettes can be considered as at least 95% less harmful. This has been replicated and tested in other countries, France, Germany, and also by non-governmental groups like the National Academies for Science, Engineering and Medicine in the USA. And they all come to the same conclusion, that nicotine in e-cigarettes and e-cigarettes as a product is much less harmful than tobacco. I think where there's always a big question mark is it 100% safe? Now, there are no consumer products that are 100% safe. Even water is not 100% safe. So one must always look at the relative harm of consumer products and make sure that overarching the safety of consumers are ensured. But what is happening in Bangladesh at the moment with this draft amendment to the Smoking and Using of Tobaccos Act is worrying, and our hope with stakeholders in Bangladesh is that the government would make any decision based on pure science and best practice in the rest of the world, rather than to get involved in the political background noise.
Just as a follow-up, I think, while you were proposing or suggesting or giving very great examples of what is happening around the world as an ideal case study, to you, Dr. Dillon, what does an ideal roadmap to a tobacco-free nation look like? I mean, so that we better understand how we need to navigate these waters.
That's a good question, Israq. And the simple answer is that, firstly, the different products should be characterized and properly categorized so that the consumers can, with confidence, listen to government regulations and understand that the government has been acting in their best interest. Now, tobacco control, we've always argued, is, and we, as a physician and as part of several NGOs, we support the Framework Convention on Tobacco Control, and we're all working towards a smoke-free world and making cigarettes history. But for those products that are emerging, the so-called reduced risk products, and there are basically three classes and maybe one fourth. It's electronic cigarettes is one, the heated tobacco products, oral nicotine pouches, and then also snus as it's used in Sweden. These are examples of reduced risk products. What needs to happen in Bangladesh, to answer your question of the ideal roadmap towards a tobacco-free nation, is number one, there should be a framework which incorporates tobacco harm reduction and acknowledges the principle of harm reduction. Harm reduction is also in play with seatbelts. Even the COVID vaccine is a form of harm reduction. You take the vaccine so that when you do get the virus, the illness is not so severe. The same as with harm reduction principles in the field of drugs, for instance. So acknowledge the role of harm reduction, set up a framework within regulation that incorporates a recognition of the relative risk, and then make sure, and this is the most important part, make sure that the regulation, the taxation, the marketing, and the communication of those products are based on risk. So if Bangladesh and its 164 million people, of which 20% of the adults are smoking, if tomorrow the government of Bangladesh were to change regulations that would make it possible for adult smokers of cigarettes to switch tomorrow to e-cigarettes, I would claim that there would be a 95% less harm for those 20% of adult smokers in Bangladesh. So if the government were to fulfill their primary mission, which is to prevent disease and premature death, if they were able to put in risk proportionate regulations and taxations for safe alternatives, you don't want to tax e-cigarettes at the same level as cigarettes. You want to create an incentive to consumers to move from the most harmful to the least harmful products. And if the Bangladesh government could set up that framework, which is risk proportionate, and then at the same time make sure that over years there would be a review of the science from all the credible institutions and all the best practices elsewhere in the world, you would find that there would be hundreds of millions of lives saved in Bangladesh and the rest of the world. There is a reason why worldwide there are 100 million consumers of these reduced free products. And I'm curious to hear what John and Martin and Schumann has to say about that. But in my practice, in my medical practice, if a smoker switches to a smoke-free nicotine alternative, the first thing they say after 2 weeks is they smell better, they can taste better, they feel better, they breathe better. Where before they couldn't go up 2 flights of stairs, they can now climb several flights of stairs. So for me as a physician and as a policy advocate, I cannot believe that we are still having this conversation. It's an obvious solution, and we should stop blocking the fire escape and make sure that adult smokers have a chance through proper risk-based regulations in Bangladesh and other countries to understand what is more harmful, what is less harmful. And I do hope that the responsible politicians in the Bangladesh government will seize this opportunity.
Thank you. Thank you so much. At this moment, I just want to encourage the viewers of our webinar that you may share your questions and opinions in the comment sections, and please share, like, and promote this very worthy cause. Coming to Mr. Shumon Zaman, I want to direct my question in a form. You, coming from the industry point of view, as well as a vapor, what are the drawbacks of the health ministry not recognizing the vape traders and vape users as stakeholders?
Thank you very much. Not recognizing vape traders and vape users will have major consequences, as many of these vapers are using e-cigarette as a smoking cessation tool. We think that nearly 600,000 people are already vaping in Bangladesh, and the number is growing every day. The tobacco epidemic will get worse without the help of smoking cessation tools such as vape. Bangladesh's goal of becoming tobacco-free by 2040 will be hindered if vaping and other NRT are banned. We feel that we could provide better approach to the issues they are concerned about regarding vaping. We need to have proper regulation of vaping and other NRT products instead of outright banning them, because so many smokers have already quit using vaping and we have barely scratched the surface. There are a huge number of smokers that we can help quit smoking using vaping. Another big problem we will face if vaping is banned is the black market. Once banned, structured vape shops will cease to exist, of course, and the black marketers will fill that void. Once that is a reality, we will start seeing counterfeits and other products which might actually be more harmful to the users. So from Bensta, we are constantly trying to have our voice heard by the relevant policymakers in order to properly address issues concerning vaping, to keep vaping alive in our country, so we can continue on converting smokers to use vaping as a cessation tool. We feel that if we want to succeed reaching the goal of becoming tobacco-free by 2040, we must make proper use of NRT methods such as vaping. Thank you.
Thank you, Mr. Shumon. I think we've got quite a few viewers who are also sharing their wonderful opinions. I would keep on urging you to share your thoughts regarding these issues, share your comments. We might take a few of these comments and questions as well. So keep on sharing. Um, I want to turn to Ms. Dr. Mithun Alamgir. Uh, in the perspective of public health, what will be the possible consequences of banning vape or other tobacco harm reduction products in Bangladesh? Please enlighten
Uh,
us.
thank you very much. Can you hear me?
Yes, yes.
Okay, okay. Before coming back to your question, I need to add something. I don't know how it will sound. Though I am in a webinar of vape-related webinar, but I'm not here to promote vape-related product or something else. I'm here to talk about the harm reduction or restoration of health. That's the only thing that I'm going to look at actually. Anyways, on the basis of, if you look at all the scientific evidences and literatures and articles, everywhere you're going to find that the conventional tobacco smoking or the analog stick are responsible for most of the non-communicable diseases, that is NCDs, everywhere in the world, not only in the developing countries, everywhere in the world. So anything which is much lesser harmful, I'll definitely promote that. That is my point of view. And if you look at the journals of, from public health of England, actually, they say it is 95% harmless comparing to the analog stick or conventional cigarette. Forget about 95%, 99%. If it is 50% harmless, then I am ready to talk about it. Because anything which is actually helping you directly or indirectly for restoring your health or the I think that is good enough evidence for that actually. Now talking about the consequences, what can happen? Everybody knows what can happen. The smoker who have quitted this bad habit, they'll come back to smoking once again. This is the only thing that can happen. And you know, there are many tools or alternative pathways to quit smoking or something like that, such as nicotine replacement therapy, nicotine gum and patches, etc. But the success rate of vaping is much higher than all this product, than all those products. Why? Because it's not something the consumer doesn't count the amount of nicotine they are going to consume. That is not their thinking actually. There is something which is actually the behavioral thing, that is the ritual. People like the rituals of smoking. Whenever you are talking with your friends or you are with your somewhere, you are in a bit strange, I would say a friendly gathering or somewhere else, your friends starts to smoke. Being a smoker, it will trigger your instinct. So vaping is more close to the analog stick that actually helps to quit smoking. Nobody talks about that. It's not about the only nicotines and other components, but the important thing is this is the behavioral or behavioral pattern or the rituals that people like actually, and that is most important thing. That's why the success rate of vaping is much higher than other alternative pathways or other alternative things that you are talking about. So I must say there are plenty of laboratories and advanced laboratories throughout the world, not only in the developed countries, but also in the developing countries as well. This is not a rocket science. Go for the biochemical tests. All the juices are there. Randomly collect them. Go for the biochemical test. you can go for the core studies, case control studies, prospective studies. You'll definitely get something related to this evidence. So I think it's not a rocket science. Why are you going to ban it? You can regulate it. You can regulate on the basis of the quality of the product, whether it's a counterfeit product or not, whether it's coming from area which is absolutely producing counterfeit product, something like that. We can talk about the quality of the product. We can regulate whether the product is consumed by the younger people or not. But I think banned on the basis of or without having any scientific evidence, I think it will be a little bit hard actually. I don't think it will be good thing to do. That's my point. And your question is very simple. And answer of your question is very simple. Those people who have quitted the smoking habit, they will come back to smoking once again. As simple as that.
Thank you, Dr. Mithun Almir. I think we're hearing some very positive, resounding agreements from even the viewers. Mr. Faisal, Mr. Imtiaz Ahmed, I see, Mr. Nawid Reza, Mr. Qazi Asfar Tariq. Yes, thank you for your comments. Yes, we all do agree that these are very interesting points that are being brought up. Viewers, please share your thoughts on how the banning of vape in Bangladesh may affect you. And I urge Voice of Vapers community to also take part. I know there are nearly 7,000 people in this community who are avid vapers, who have left smoking to join a much healthier lifestyle. So if you agree with us, if you have a point of view, please do share. I do want to go to Mr. Michael Landau. Now, do you think vaping should fall under the Smoking and Using of Tobacco Control Products Control Act? What do you think?
I mean, the easy answer after everything we heard so far is obviously no. That would have very bad consequences for public health, consumers, and basically everyone in every country. But I think the fact that politicians and public health advocates still try to do those kind of things shows how much misinformation is out there. And I think there are several reasons why vaping shouldn't be regulated the same as smoking. The first and I think foremost most important point is that people need to understand vaping is not the same as smoking. We have already heard it's way less harmful. So every person who switches from smoking to vaping should be actually celebrated as a public health win and not be demonized, or like some tobacco control people tell them that's not actual quitting. Because most people fail when they try to quit cold turkey. So switching to a way less harmful alternative is a public health win. And I think another point, which especially a lot of lawmakers don't understand, that all these different kinds of nicotine products are substitutes for each other. So consumers react to incentives and changes in the regulation. So therefore, it's quite obvious that the more harmful products should be more expensive, the less harmful products less expensive, and regulated according to its risk. And since quitting smoking is so hard for most people, we also need as much choice as possible, because people are very different. And I think that is also an important point to understand, that is why vaping is so successful as a smoking cessation aid, because it is so individualistic in some way. It starts with all the different devices, the different flavors, the different nicotine levels. People can play around and find the optimal solution for themselves. So I think to restrict those kind of choices and possibilities will definitely hurt smokers, because everyone is different and needs different routes and different products to quit smoking. And obviously, as already mentioned, this kind of over-regulation or even bans leads to the creation of even bigger black markets, which also has very different or very negative outcomes. So I think overall it's quite clear that we need to look at the risk continuum of all these products and regulate it accordingly. And we did last year a rough estimate where we compared the vaping rates of the UK to a lot of other countries where we could get the numbers, and in Bangladesh we could get them as well. And I think it's a very low estimate and a very safe one. And we saw that if Bangladesh would incorporate the same regulation as the UK has, about 6 million people would switch to vaping. And on the background of more than 100,000 deaths per year, I think this is the route politicians should go and look at the UK's approach, and not this crackdown and prohibition, which never works and never did work in history.
Thank you. Very nicely put. I think we have a question from the audience. Mr. Imtiaz Ahmed has a question to John Dunn. Actually, I do have a question as well. Let me favor the audience first. So, Mr. Imtiaz has asked us, um, and Mr. John Dunn, if you can answer, how can the government benefit from regulating the industry? How much revenue did the UK government earn as revenue from the vaping industry? If you can have any thoughts on that.
Absolutely. I think what's important to understand with the UK is they take a very different approach. They don't look at this purely from a revenue generating standpoint. What they look at, having a national health system that's funded wholly by the government, what they understand is that by creating a healthier environment and a healthier population, the money that they save in long-term health effects and long-term treatment far outweighs any revenue that they are potentially losing from not adding extra taxes to vaping. And even actually, one of the debates that's going on here is how do the government make vaping devices more affordable to people with lower incomes? And one of the solutions that has been suggested is actually reducing the value-added tax here from 20% to 5%. To bring it in line with other nicotine replacement therapies. We've also heard that the government here is really encouraging companies to go down that medical route. Although, for me, I think that's a non-necessary avenue for them to take. But it just shows how our government is thinking. And to go back to an earlier point as well on the relative safety of these products. We've had a lot of misinformation here in the press recently, and one of the focuses has been around adverse effects of vaping. And the medical regulators here monitor through what we call the yellow card system all the adverse effects for any drugs or substances that they're in charge of. And over the last 3 years, they've had roughly around 200 reports of adverse effects from vaping. And that can be anything from, it made me cough, I didn't like the taste, etc. But to put that in perspective, that's 200 over 3 years. In the last 14 days alone here, they've recorded 368 adverse effects to the COVID vaccine, and that's in 14 days. So to me, with now 4.2 million people vaping here in the UK, that really says a lot about the relative risks and the relative safety of these products.
Thank you. I mean, that puts a lot of perspective into the question. I hope, Mr. Imtiaz Ahmed, you're satisfied with that question. Mr. Azman Haq is saying adults who otherwise would continue to smoke have a right to receive accurate information about the better alternatives science has made available, and they should be permitted and encouraged to switch to these products rather than continue smoking. Access to better alternatives is a human right that deserves recognition and respect. Mr. Azman Haq, respect to you. Thank you very much. Yes. Mr. Abid Hassan is saying, I am Abid from Bangladesh. Today, my question is that don't you think it will be more harmful for younger people? I definitely think so. I am going to follow up on Mr. John Dunn with a question of my own. Countries which support vaping as a credible harm reduction method, uh, their smoking cessation rates are twice as fast compared to the global average. So why ban vaping? I know you've touched upon this, but I would love to hear from you in a bit more detail.
I think for me, there is no question that vaping should not be banned or restricted in any way. It has to, as the other previous speakers have said, the attitudes towards vaping have to be risk proportionate, the same as other alternatives out there as well. And I think it's important for governments to really step away from this whole moral issue on nicotine and realize that you know the goal here is to switch people who are smoking combustible cigarettes, which we know, has a very high risk of killing them, to whatever safer method works for them. And the key here is that not every method is the same for everybody. It doesn't work for everybody. So whether that's giving up cold turkey, whether it's using patches, gums, snus, pouches, vaping, it doesn't matter. The key here is to move people away from combustible tobacco. And if we can even do that for one person, to me, that's a win.
Great, great. I think, thank you for your answer. I think we have a very important question here from Mr. Murad Naim Chaudhary. Mr. Chaudhary is asking how we could work on awareness of lawmakers and politicians regarding the benefits of vaping. With your kind permission, I'm going to take this question. As the convener of Voice of Vapers in Bangladesh, I think one of the key things that I always believe and we want to promote as a community is to raise our voice. Now, how do we raise our voice? Or how do we bring our point or opinion to the policymakers? I think one of the best ways to do it is through a proper channel, is through the proper guideline. You know, if joining Voice of Vapors will allow you to sign a petition. And this petition, I'm happy to say, already 6,000 people or more, if I haven't counted today, has joined in sharing their voice. I think this is very important. Singularly, if I say something that may not make an impact, but collectively, our voice is much stronger. And if you truly believe that there is merit to what we are saying, join this cause, sign the petition, join the movement for the right to vape. I think that is the best way. And of course, we have other credible informations, credible sources to back up what you're saying. So I think that is the best approach. Now, I would like to bring up some more questions. I think we're at the kind of like the end of our. I think Mr. Fahim, Mr. Muntasir Rahman Fahim, yes. He has a question for Dr. Dillon. Bangladesh Ministry of Health and anti-vaping NGOs referred to WHO and CDC while calling for ban. Do you have any comments? Why aren't they realizing the good potential of vaping for public health? That's a very good question, Mr. Fahim. Dr. Dillon. I think, yeah.
It's a relevant question, and it's a fair question, because governments look at the World Health Organization, and the Center for Disease Control in the US is also used by the population and organizations in the US to receive trustworthy, independent advice on individual and population health. So it's a very valid question. And it's something that I have been grappling with, that the WHO is willing to show leadership and make some remarkable progress in a field, for instance, like COVID, where in a very short period of time, over the last 2-3 years, WHO was one of the leading organizations and premier technical agencies in public health to help evaluate the relative safety of vaccines and then provide their member governments, the member states that form part of the World Health Organization, provide them with the advice and the policy making principles to come to a point where COVID is now almost an issue of the past. And it was done through the vigorous use of science and by making use of best practice all over the world. And the vaccine was accepted as beneficial for public health by WHO, and then many countries, Bangladesh included, followed their advice. Now, this question is, why isn't the same happening in vaping? Why is tobacco harm reduction still being seen as not possibly the answer in addition to what is being done for tobacco control? And I don't have any good answer to that. WHO would claim firstly that there isn't enough evidence that electronic cigarettes are safe. Now, I think, like Dr. Alamgir, I'm not here to sell vaping products. I'm a physician and an individual and population health advocate. I would want the best for individual smokers who cannot or would not quit smoking. So WHO, instead of providing direct, clear, science-based answers, are letting member states understand that because there isn't enough evidence, they should consider a ban or very draconic regulation of these products, which is contrary what they did in the field of COVID. So both WHO and CDC should definitely use the same principles and apply the same rigorous scientific methodology to come to an assessment and then a recommendation to the population. It is not acceptable to say that there is not enough evidence. The United Kingdom, as John Dunn has also mentioned, has now a 10+ year history of adult smokers that have switched to vaping products as a means of smoking cessation, with very positive individual health and public health results. So WHO has no excuse anymore. They should be looking at the relative safety of these products. And in addition to the very worthy projects to encourage smoking cessation, they should acknowledge tobacco harm reduction as another escape for adult smokers who cannot or will not smoke. And they should do that immediately without any further delay, because a delay is costing lives.
Perfect. Thank you, Dr. Dillon. I think we have quite a few questions. We will take a few of them. Mr. Naweed Reza has a question for Dr. Mithun Alamgir. Dr. Mithun Alamgir, sir, why are not public health advocates raising voice in Bangladesh to support vaping as a healthier alternative? Why are they so misled and misinformed? That's an interesting question. Dr. Mithun Alamgir.
A new concept for Bangladesh. Actually, it is absolutely new to us, and somehow there is, I must say, there is some negative publicity about vaping throughout the country. Some people, those who are eligible to talk about it and well equipped to talk about it, probably they are not in the field or in front in the upfront of the arena actually, and that is the thing. At the same time, the perception of something that you are having in your body, they take it as a conventional cigarette, but nobody is talking about the positive thing of vaping. At the same time, there are a lack of research work in this country. That is also very important thing. We do not have our own research activity or research papers. On the basis of that, we can say this is the evidence. On the basis of that, we are saying that. What we are referring, there's absolutely research work which is done by some other people from other countries. So many things. That at the same time, government also taking it in a different way, different angle, looking at it from a different angle. So many things. At the same time, some NGOs are working against it. So it has to be a collective effort, and there should be a community composed by the vapers, the resource persons, and the person who are active. And there should be some research work. That is very important. There should be some independent research work, institutional research work. On the basis of that, we can easily say, yes, this is the finding that we are talking about. And I think that is the main reason behind it. And people are actually not saying positive about vaping. That is the most important thing. There should be some campaigning. You can say it's a campaigning or something like that. There should be some NGOs who are working for these products. Not only vaping, there are some other products also. There are some other products. Because my point is, actually, we are not saying vaping is 100% safe, but it is much lesser harmful. That is the point that we need to talk about. It's much lesser harmful. And if you have something which is much lesser harmful, you have to promote that the way you want, but you have to promote that. That is the thing I'm talking about. And I think it's a collective effort. That's why it's not working in this country properly.
Right.
Thank you very much.
Let's hope it does. We have a very interesting statement from Miss Sadia Islam. She believes that the health ministry should see this live and know the truth and facts. Say vaping, say Congress. We hope so too. We actually want to encourage and bring a collaborative effort to policy making. Um, Now, viewers, thank you very much for all of your questions. We definitely want to hear from you about what your thoughts are about Bangladesh implementing vaping regulations like other best case scenarios in the UK, France, New Zealand, and Canada. We don't want to talk about negativity. We want to talk about what are the positive steps going forward. I do want to take this chance to thank every one of our panelists as well. If you have any last statements, we welcome that. Mr. John Dunn, Mr. Shumon Zaman, Dr. Dylan Human, Mr. Michael Landau, and Dr. Mithun Alamgir. Thank you very much. If you have any last statements or comments, we will welcome them.
Perhaps just an encouragement to Bangladesh to become one of the world's role models and best practice countries, where the 20% of the 164 million Bangladeshis who still smoke, they should really take this up as their personal plea and motivation to the government as well, to make sure that their human rights are respected, that the ethics of credible and independent information provided to them is respected, and that most of all, that their individual health and that the risks and benefits to population health are clearly taken into account by government as they now assess this tobacco bill and make sure that tobacco harm reduction and tobacco harm reduction products are included as one of the measures to help improve smoking cessation in Bangladesh, but more importantly, for those adult smokers who cannot or will not quit smoking, to give them a fire escape and to help them to lead a normal life without tobacco-related disease. And we wish you well in that endeavor.
Thank you.
If I may add a little, I would like to say that common sense should prevail, and we all should stop believing in Facebook posts or statements in the paper like studies shows that this is harmful, that is harmful. We should start asking question that which study, where did you get this information from, rather than believing or taking note of that statement, just one-liner or two-liner. We all should actually look really into what is vaping all about, and we should really, it's not that hard actually. You can find it online, you can Google it. I'm talking to the potential people who are willing to quit, as well as I'm trying to address to the respectable policymakers that we really should try to do our own homework and do the research and look it up. Why UK is saying it is 95% safer, and look at other countries who are having a lot of success with these tools. Rather than simply believing one or two liner comments from this and that, or this agency saying this, or pushing some agenda. This is really, really very vital for the cause. Thank you.
Thank you. Thank you.
Then let me quickly take the opportunity to thank you for putting together this amazing webinar. And I think that's exactly what we need. The scientific evidence is important, but we need also to spread this information. And I think this is exactly the way to do. Nobody else will do that for us. So we need to raise our voices wherever we can to change the things we discussed.
Thank you, Michael. Thank you.
Absolutely true.
Mr. John Dunn.
I kind of agree with all of the speakers, actually. This has been a fantastic webinar. I think we've got some great speakers on here, but it really is about raising your voices and being consistent in that message. You know, this is the right thing to do. This is a good thing for Bangladesh. And you have to keep knocking on doors. You have to keep talking to people and never give up until you win.
Thank you. Thank you. And lastly, Dr. Mithun Alamgir. Very shortly.
Thank you very much. Yes. I must say, please don't go by the perception. Please go with the scientific evidence. And you have that, please go for it. And read it, do it, and you'll have everything in your hand. Please go for it.
Thank you. Without further ado, I think we've had a very interesting discussion. I thank all the panelists again. And my last statement would be that we would request the vaping community to unite. And as I said before, to sign the right to vape petition on the Voice of Vapers Bangladesh website, as the implementation of a vape ban will collectively affect all the people of us who are trying to quit smoking and live a healthier lifestyle. You can also join the revolution by joining our Voice of Vapers Facebook group and stay updated with the ins and outs of the vaping world, and also get credible information and scientific evidence for this cause. Lastly, and not the least, we would humbly request the Ministry of Health and Family Welfare to reconsider this vape ban and include all the stakeholders from the vaping community when drafting legislation regarding vaping in Bangladesh. That brings us to the end of this webinar. I thank all the viewers. I thank the panelists. And let's save vaping. Let's save Bangladesh. Thank you. Good afternoon. Assalamu alaikum.
Thank you very much.
Thank you.